Researchers in Scotland, England, and South Africa have found that Omicron infections more often result in mild illness than earlier variants of the coronavirus. Dr. Monica Gandhi is an infectious disease doctor and professor of medicine at UCSF and joins us now. Dr. Gandhi, good to see you this morning here. So good to see this news on the Omicron front for sure. As someone who is so close to this, does it suggest we may reach a peak here with this variant in the country at some point this winter?
Yes. I mean, the other thing beyond what you just said, which is that this Omicron variant looks more mild. And how do we know that? Well, it's 80% less likely to cause hospitalizations than other waves. In South Africa, it's 60% less likely to cause hospitalizations than Delta in the Scotland data. So this is really amazingly less virulent. And it also peaks fast. So it peaked quite quickly after about 3 weeks in South Africa. So it started here fast as well. And we're thinking it will probably peak in even before mid-January. So it's also coming down fast. UK may have reached its peak already.
Dr. Gandhi, it's Julie here. Even with the Omicron variant and the speed with which it appears to be spreading, you wrote a really fascinating piece for Time where you talked about how we need to change the framework of how we are approaching this disease, even with this variant. What do you think is the most important change that we need to make?
Yes, I mean, we need actually a more rational approach to how we're approaching the pandemic. We can't stop spread completely. It's just too transmissible. So the main part of that piece is really that what we should be measuring our success on is hospitalizations from COVID, and we likely can't prevent all these cases, but they're often extremely mild or they're even asymptomatic because we're testing so much. So Singapore did this 2 months ago to save their economy and also to save people's sanity. They only focused on hospitalizations. They track cases in health departments, which we should do too, but the public only knows about hospitalizations. For example, California here, very low hospitalizations. New York, very high cases, very manageable hospitalizations. This decoupling of cases and hospitalizations means we need to change our approach and look at the success of this virus as preventing illness, not every case.
And do you think, of course, the administration came out with a new, renewed approach to the virus this week, including increasing testing and some other measures. Do you think they're getting the message that you're talking about, though?
No, actually, there was a hint to CNN that they were going to take this approach on Sunday, and then they didn't come out and use this approach. I think it's a very sane, rational approach. It's what Singapore did. It's focusing on what's your metric of success. And it also, which is preventing hospitalizations, it also keeps schools open. It also keeps the young from mass asymptomatic testing. We also recommended not blanket mask mandates, but masks for people who are high risk, who are more vulnerable to severe breakthroughs. We also focused on CDC tell us who's at risk for severe breakthroughs so we can be very focused in our protection of those individuals, and then focusing on people getting unvaccinated who are unvaccinated getting vaccinated. So it was kind of a 9-point plan. It came out yesterday, and I'd encourage people to read it because I think it really makes sense with Omicron. But no, I don't think the administration yet is quite there.
Doctor, why do we see mutations like this take hold or take form, and should we expect more to occur?
So, the spike protein, which is the piece of the virus that sticks out and sticks to the host cell, is very susceptible to mutations. In fact, it happens with influenza, which has 2 spike proteins, H and an N. But luckily, there's so much of the virus that doesn't change. For example, what's called our T cell response, our other ability to fight the virus is still intact against all these variants. But yes, variants are going to emerge. This one looks like it could be less virulent, which not just because we have more immunity, but because of its inherent properties. It doesn't look like it infects lung cells very well, according to 2 studies, one at the University of Hong Kong, one at the University of College London. So this is a, if you will, better variant to emerge, but other variants are going to emerge, and we're going to always have COVID with us. That sounds depressing, except for the fact that we actually have almost every pathogen in the world still with us, except smallpox, and we've learned to deal with it. We use vaccines and we use therapeutics. We have vaccines, we have Paxlovid now as of yesterday. We can deal with this virus, but if we try to stop the spread like we have been doing, we're shutting down society, we're shutting down schools, we're for minor cases, we're going back to schools at the end of January instead of now. This is not the way to deal with a highly transmissible respiratory virus. We can still control it, but we can't do it this way.
As the parent of 2 school-age kids, you are speaking my language on that front in terms of keeping schools open. Remind us, Dr. Gandhi, what you're talking about is that coronavirus in some form is going to be endemic at some point. Right. Remind us, how do we know that it has changed from pandemic to endemic, and how close are we potentially to that point?
This is a great question. So like you indicated, we know it's going to be endemic because of 4 features. It has animal reservoirs. It's highly transmissible. It looks like other respiratory viruses, so you can't isolate it and just take it away from society. And then it has a long infectious period, but it has a good vaccine. So how do we know when it goes from pandemic to endemic? Well, many places in this country, it's endemic. For example, in California, we are massively much lower in our hospitalizations than this time last year. In fact, our hospitalizations are less than 10 over 100,000. And our definition of endemicity that we propose is having people in the hospital less than 10 over 100,000, which is much less than what we accept for flu. It's 20 to 40 in the winter, and that we have high vaccination rates. That should be the definition of endemic. There are many places in this country that have reached endemicity. And then what we do is focus on protecting people who are at risk for severe breakthroughs, immunocompromised, elderly, multiple medical conditions, strong masks, boosters, and ensuring that they're protected. And then we go on with the society. It's what we do for influenza when we've gone from pandemic to endemic.